Robin really challenged our profession. He made us think outside the box and had us challenge things that we thought were facts. He taught us to listen to our patients and partner with them in a way that only others pay lip service to. He showed us it was okay to think outside the box, question old teaching, and to challenge new ideas in research.
I think Robin is one of those rare folks who really changed our profession during his lifetime. He completely created a paradigm shift in patient care evaluation and treatment, and his foresight and tenacity in sponsoring research will ensure that his legacy doesn't die.
He really challenged authorities. He challenged the way things were done initially, and he used the evidence of what he saw in the clinic and his outcomes to really build the support for that challenge. And he went worldwide with it. And we all know that something has to have validity for it to move as quickly as it did and to be adopted by so many areas. It's a worldwide phenomenon. It's a technique that you're going to find used the same way whether you're in Nebraska, whether you're in Japan, whether you're in New Zealand, whether you're in Canada, and I find that somewhat remarkable.
When Robin began developing his musculoskeletal classification and treatment concepts way back in the 50s, 1960s, there was very little epidemiological evidence to guide him. He, however, was an astute observer of patients' posture and movement strategies. And by chance encounter, he observed that one of his patients, while lying in extension on a treatment table, reported that his back and leg pain abolished. That fortuitous moment started a lifelong yearning, clinical observations, experimentations, and the development of a treatment-based classification system known today as mechanical diagnosis and therapy.
Mr. McKenzie changed the world from a mechanical perspective. The majority of healthcare is attempting to change back pain through chemicals and surgical intervention. We were all missing the boat that most back pain is mechanical and needs to be affected in a mechanical way.
It's a safe method since the patient is often starting with patient-generated forces, then patient-generated forces with the patient doing their own overpressure, then the clinician jumps in with their overpressure or mobilization or manipulation. So it allowed therapists to go into a series of courses and learn how to educate the patient in achieving those wonderful outcomes.
I think his contribution also then affected patients all over the world. If he wouldn't have been willing to put himself out there, there are thousands, probably a million patients that never would have gotten better because of the therapists that were able to treat their patients based on his teachings.
And probably the most compelling thing that when I think about McKenzie is, and many people will remember when Larry Bird was doing prone press-ups at the side of a basketball game when he was pulled out. And he was sidelined for months with a back problem, a disc-related problem, until he saw a McKenzie clinician. And he was doing his prone press-ups in between to help self-treat his back so that he could get back into play. Those are the things that really, to me, are remarkable, and how much McKenzie has affected how backs are treated worldwide by physical therapists.